Hello everyone and welcome back to my channel. In this video, I will be discussing how to rescue an emergency situation from heart attack, and I will also be sharing some steps to performing CPR. I hope that this video is helpful for anyone who want to help people in emergency situation and in learning more about help technique of CPR. CPR stands for Cardiopulmonary Resuscitation, which is a life-saving technique used in emergency situations to manually pump and circulate blood to the body's vital organs when someone's heart has stopped beating. This can help maintain blood flow and oxygen to the brain and other organs until medical help can arrive. CPR involves chest compressions and, in some cases, rescue breaths to help keep the person alive until emergency responders can provide more advanced medical care. Can you explain the steps of performing CPR? Sure. Here are the basic steps for performing CPR on an adult. 1. Check the scene for safety. Make sure the area is safe for you and the person in need of assistance before approaching. 2. Check for responsiveness. Shake the person gently and shout their name to see if they respond. If there is no response, the person may be unconscious. 3. Call for help. If someone is nearby, ask them to call emergency services, 911, while you begin CPR. If you are alone, perform CPR for about 2 minutes before taking a break to call for help. 4. Open the airway. Tilt the person's head back and lift their chin to open the airway. 5. Check for breathing. Look, listen, and feel for breathing. If the person is not breathing or only gasping, they need CPR. 6. Begin chest compressions. Place the heel of one hand on the center of the person's chest, place the other hand on top, interlock your fingers, and start compressions. Press down about 2 inches at a rate of 100 to 120 compressions per minute. 7. Give rescue breaths. Optional if you are comfortable and trained in CPR with rescue breaths, you can give 2 breaths after every 30 compressions. 8. Continue CPR. Continue cycles of 30 compressions and 2 breaths until help arrives or the person starts breathing on their own. Remember, the most important thing is to act quickly and do your best to provide assistance until professional help arrives. It's always best to be trained in CPR and take a CPR course to ensure you are prepared for emergency situations. Do you have any tips for remembering the correct rate of compressions? Yes, there are a few tips and tricks to help you remember the correct rate of compressions, 100 to 120 compressions per minute, when performing CPR. 1. Sing a song. Choosing a song with a tempo of around 100 to 120 beats per minute can help you keep the right pace. Some popular examples include Stayin' Alive by the Bee Gees or Another One Bites the Dust by Queen. 2. Use a metronome app. You can download a metronome app on your phone or use an online metronome to help you keep the correct rhythm and rate of compressions. 3. Think 1 and 2 and 3 and 4. Counting out loud with a rhythm can help you maintain the correct pace while performing compressions. Say 1 and 2 and 3 and 4 to yourself as you press down on the person's chest. 4. Practice beforehand. Taking a CPR course and practicing on a mannequin can help you get a feel for the correct rate of compressions before an actual emergency situation arises. By using these tips and methods, you can help ensure that you are providing effective chest compressions during CPR and potentially save a life in an emergency. Counting out loud with a rhythm can be a helpful way to maintain the correct rate of compressions during CPR training and in real-life emergency situations. It can help you stay focused and ensure that you are providing effective chest compressions to the person in need of assistance. Practicing this technique during your CPR training session will help you feel more confident and prepared to perform CPR if the need arises. If you have any other questions or need further assistance, feel free to ask. Stay safe and prepared. When performing CPR, it's important to follow these general steps and precautions to ensure the safety and well-being of both yourself and the person in need of assistance. 1. Check the scene for safety. Make sure the area is safe for you to approach and that there are no hazards present that could pose a risk to yourself or the person in need of assistance. 2. Check for responsiveness. Shake the person gently and shout their name to see if they respond. Look for signs of breathing or movement. If there is no response, the person may be unconscious and in need of CPR. 3. Call for help. If someone is nearby, ask them to call emergency services, 911, while you begin CPR. If you are alone, perform CPR for about 2 minutes before taking a break to call for help. 4. Open the airway *, tilt the person's head back and lift their chin to open the airway for breathing. 5. Check for breathing *, look, listen, and feel for signs of breathing. If the person is not breathing or only gasping, they need CPR. 6. Begin chest compressions *, place the heel of one hand on the center of the person's chest, place the other hand on top, interlock your fingers, and start compressions. Press down about 2 inches at a rate of 100 to 120 compressions per minute. 7. Give rescue breaths, optional if you are trained in CPR with rescue breaths, you can give 2 breaths after every 30 compressions. Otherwise, focus on chest compressions only. 8. Continue CPR *, perform cycles of 30 chest compressions and 2 breaths, if trained, until help arrives, the person starts breathing on their own, or until you are physically unable to continue. Precautions to remember when performing CPR include: make sure the person is lying on a firm, flat surface. Avoid excessive force when performing chest compressions to prevent injury. Ensure that the person's mouth is clear of any obstructions or foreign objects before attempting rescue breaths. If using an automated external defibrillator (AED), make sure to follow the prompts and directions provided by the device. If at any point you feel uncomfortable or unsafe performing CPR, or if the person shows signs of regaining consciousness, stop and wait for emergency responders to arrive. Remember, the goal of CPR is to keep blood flow and oxygen circulating to the body's vital organs until professional medical help can arrive. It is important to stay calm, act quickly, and do your best to provide assistance in emergency situations. Learning about the steps and precautions to take when performing CPR can help you feel more prepared and confident in your ability to assist in emergency situations. By following the recommended guidelines and being aware of safety measures, you can help provide life-saving care to someone in need until professional help arrives. It's important to stay calm, act quickly, and remember that any effort to help can make a difference. If you have any additional questions or need further information, feel free to ask. Keep up the good work in staying informed and ready to help others in need. Thank you for watching, and don't forget to like and subscribe for more videos on health and wellness. Take care and see you in the next one.